This one is going to be action and orientation. If you remember during lunch, Jerry walked around and kind of assigned / invited each table to talk about, to think about a priority. And I hope you had some good conversation between your lunch. But now we're going to dive into that a little bit. And as usual, anytime I'm up here, I'm going to ask you to do something a little bit strange. And make a list, mental or written, of the things that we could stop doing. And simply by virtue of not doing these things anymore, it would help advance that priority. Write them down, think about them.
Our topic was bring the voices of lived experience into the group as partners. And then we began to say, what can we stop doing? And we can stop hosting events, planning events, creating boards, advisory councils, and attending legislative meetings without our community partners. We can stop ignoring cultural differences, as we said, and how our community partners access the services. We can stop pretending that there isn't a difference. And we can stop ignoring lived experience people as the experts, because we are not. And we can stop hoarding resources. We can start sharing them when we have events that are not for providers to talk to each other.
Probably the table over here. Our group was established a centralized hub where services and providers can be co-located and accessible to families who need them. And so some of the ideas we came up with were stop admitting self-defeat. I like the phrase I can't, shooting down ideas. Stop judging. Stop the competition between organizations and other services as well. Stop ignoring the community layout, lack of structure. Stop limiting inclusivity. Stop focusing on a community that excludes population. Stop separating organizations and services. Try to build like that collaboration. So that was what we came up with.
This was ensuring that providers in other communities know about each other and provides and developing formal networks for working together on behalf of families. So
we said stop working in silos, stop restricting services, especially if you have, if you're with that organization, you can't be in ours. Stop penalizing families for not having their basic needs met. Stop with the politics and stop competing.
Yeah. Our question is, develop strategies for overcoming barriers to getting families what they need. So, as service agencies, stop hiring people who do not care.
Well, that's really my mantra, if you will, is always assume positive intent, and so I went stop assuming negative. Stop telling people what they need. A couple of ours were mentioned, so I'm going to skip it through here. Don't just do the first aid, teach it too. Stop using our disparate communities, extracting data from them, using them for financial gain, and then I can take credit for that one. That was from Tyler. Shut up. Stop abusing funding and use it for an intent.
And the one I added was just stop talking at people and be intentional and listen to what they
All
need.
right, so our question was, address the most common reasons that families become involved in child welfare and development strategies.
All right, so number one is stop requiring appointments for services. A lot of these families are just, they can't just stay strict to an appointment. Maybe just one day I can come in, we need to have more walk-in basis resources available. Stop in-person appointments only. That kind of goes hand in hand with the other one, maybe open some virtual options. Or let's make it so that we can do things over the phone. COVID did make things a little bit more comfortable to do things over the phone, and a lot of people got accustomed to that. And now it's gone. And a lot of these people said, forget it. Now I can't do it over the phone. I'm not gonna go ask for it. I'm just gonna sit at home. Stop assuming families have knowledge of the resources that are available. So let's get together and start educating each other and our families and our communities about what is out there. Just because somebody has a leaky roof, they have no idea how many different resources there are out there to help them. Even if it's just to help get somebody on their roof, there could be a resource. Connecting them to contractors and so forth. Stop limiting the amount of help and putting limitations on how often you can get help. I think we all said that. As well as stop judging or using judgment based off someone's needs. Stop making them come to us. Let's go see them. Let's go meet them somewhere. That kind of touches base on the whole hub. Let's put some hubs out in the community instead of being at this one place all year long. Get on the bus and come see us. Go have somebody bring you. Which is another thing. Stop assuming everyone has reliable transportation.
I would just like to say we are vulnerable people.
Provide early intervention and prevention with children in schools was our topic.
So a lot of the things that have already been said, we came up with as well. I did table add one at the bottom, sorry. So one of them was stop closing schools in the summer. Stop being rude, disrespectful when talking to parents and families. Stop ignoring the needs of the families. Stop assuming you know what will work for the families and the children. Stop doing all the talking. Stop stereotyping, stop judging, stop shooting on people. Stop giving up on the people and the kids. Stop all negative thinking about the parents and the children. Came up with, we stop putting it all on the teachers to do.
Yeah. We're gonna do it again. But this time, you're allowed to make your lists of things we could start doing. All right, now, there are no constraints on this. It could be the simplest thing that requires no money, or you could go for a systemic start. It might require a new law or a new policy or funding.
It's the next meeting, so. Okay, so ours again was the provide early intervention and prevention with children in the school. So some of the ones, and if I miss any table, feel free to shout it out loud and proud. All right, the first one, we have make schools a safe place for families to get their needs met. Start listening to parents' concerns before it gets really bad. Start treating every person who comes into the school with respect, no matter who they are or what they look like. Start checking in on families and students. Start providing praise and focusing on the positive things. So it's not always a negative phone call from the home, it's a positive phone call as well. Start fully funding schools. Start fully staffing schools and programs and services within schools. Start asking families what they need. Start talking with the staff within the school so they know what services are provided within their school system as well. So they know what pathways are available for everybody. All the pathways, not just certain ones, right?
Okay, we had provided education to the community at large about what families need. Oh no, that's the wrong one. Sorry, I switched tables. Ensure that providers in both communities know what each others provide and develop formal networks for working on behalf of families. So we said, put family needs, they don't know I added this one. Put the family needs first. Use the designated communication channels with clear messaging, use collaborative tools to stay informed, be transparent, not be transparent, transport clients or meet them in the community. Transport clients or meet them in the community. Use technology to reach the clients and be transparent.
So again, we have established a centralized hub where services and providers can be co-located and accessible to the families who need them. So some of the ideas we have are start caring for others, be good for all. Start being bold, asking for what you need. Start finding advisory boards. Start building relationships for public transportation, accessibility. Start utilizing structures that already exist. Start more outreach events. Start building up rapport with different individuals from different agencies. And start support for each other, us here.
Okay, so I'm sure. Bring the voices of lived experience into the group as partners. We had start inviting community members to the table, start conversations about barriers and needs, start educating staff and communities on what to stop doing, start saying I get to help instead of I have to help, or it's my job. Start smiling, start getting involved in being part of the solution, start platforms for collaboration, start involving families into conversations with professionals, start sharing advocacy opportunities with community members, start engaging in the communities you serve in celebrations and struggles every day, start communicating in understandable, inclusive language with our families and communities, start creating safe spaces for collaboration among those who receive services as supports and including outside community members for education.
Start asking the family how they would like to participate. Although we would want them to be a part of the boards, they may not be best served. Someone may be an expert in just a different lane. So once you get to know them better, you will identify their strengths and how they are able to serve. Start including stipends to encourage participation. Start sharing resources amongst providers. If you are not able to assist a family, you should be sharing of other agencies who may be able to provide that service. Start assuming that families know what's best for them, but they need assistance navigating those resources. Stop. Start assuming that our community, they do want it. And they are not ready. They just need some assistance. Oh, and I'm not gonna say that, surveys. Start surveys. You know, and asking questions that are important that we have the answers to.
Okay, our question was, develop strategies for overcoming barriers to getting families what they need. All right. Do you want to do the first one? Okay. We start bringing resources to the families. Develop deeper relationships and be intentional with them. Be consistent. Start being consistent. Start working together with other like-minded agencies. Start using neighborhood groups for advocacy. Start addressing literacy so people know how to navigate what's around them.
Start treating others the way they want to be treated. Start being curious. Start working open. Start aligning organizational actions with the organization's mission. That personally do. Start bringing more awareness of cultural humility and empathy. Start bringing back opportunities for skill building and connection, and start communicating.
All right, and ours was address the most common reasons that families become involved in child welfare and developing strategies.
All right, so some of our starts is ask families their strengths and help them build from there. So essentially self-empowerment, start making home visits, start using more empathy, meeting people where they're at mentally and emotionally, start having difficult conversations with folks in the organization and the community, start accepting walk-ins, start offering benefits without being asked, start more events and interactive seminars, start more educational interaction, start communicating with other agencies, so not reinventing the wheel. Start communicating, start empowering children and their families, give them a leg up and hear them out. Start building trusting relationships with families and start following up, doing what we say we do.
Start resolving known differences between agencies and working together. We think there's actionable strategies that can come from both the stops and the starts. And we think it's part of our charge together to review all of those and come up with some ways that we can put them into action and make them kind of a way of being. A lot of those starts and stops aren't going to cost any money. And a lot of them could start right away. Others of them will require some prolonged advocacy campaigns and some legislative work.